How do you identify roseola by its blanching rash in children? Imagine your child suddenly running a high fever for a few days, then the fever just drops away, and suddenly a pinkish rash appears. This pattern is a key clue to recognizing roseola. Roseola is a common viral infection in young children, usually between 6 months and 3 years old, caused by human herpes virus 6. After several days of high fever, the fever often ends abruptly, and within a day, a distinctive rash shows up. The rash consists of tiny, pink to red spots or flat patches that usually start on the child's chest and stomach. From there, it can spread to the neck, arms, and sometimes the legs, but it rarely appears on the face initially. One of the most important features of this rash is that it is blanching. That means if you press gently on the spots, they turn white or lose their color temporarily. When you releases, the color comes back. This blanching indicates that the rash is caused by dilated blood vessels rather than bleeding under the skin. It's a hallmark sign of roseola. The rash typically lasts from 1 to 3 days and appears after the fever has gone down. By then, the child usually looks and feels much better, which helps distinguish roseola from other illnesses that keep children unwell longer. The rash itself is not itchy or painful. It's a gentle, pinkish rash that signals the fever phase is over and the illness is resolving. To identify roseola by its blanching rash, watch for this pattern. The child has a sudden high fever lasting several days, then the fever drops quickly. Within a day, a pink rash appears mainly on the trunk and spreads outward. When you press on the rash, it turns white temporarily, confirming its vascular nature. This pattern, high fever followed by a blanching rash, is typical of roseola and helps differentiate it from other childhood rashes, like chicken pox or measles, which have different features and timing. Parents should keep an eye on the child's overall condition. The rash itself is harmless and usually goes away on its own. However, during the fever phase, it's important to monitor for febrile seizures, which can happen with high fevers. If the rash or other symptoms change suddenly or seem worse, it's always best to consult a healthcare professional. Remember, every child can have a slightly different experience, so medical advice tailored to your child's specific situation is essential. Recognizing this pattern of high fever followed by a blanching rash can help you understand that the illness is passing and your child is on the mend.